Hello everyone, today I am going to discuss about the antidyslipidemic drug. So this is the second video on this topic. In my first video I have told briefly about the various type of lipids, then lipoprotein. There are the 6 type of lipoprotein. We have chylomicron, we have chylomicron remnant, we have very low density lipoprotein, then intermediate density lipoprotein, then low density lipoprotein and high density lipoprotein. Then about the apoprotein, then lipoprotein metabolism, then what are the various type of lipoprotein disorder, both primary and secondary. So in the today's video I will be discussing mainly the anti-dyslipidemic drug. Let's quickly revise the lipoprotein metabolism, because if you understand this it will be easy for me to make you understand about the anti-dyslipidemic drug. So what I have just a quick reason of lipoprotein metabolism. So what we take a lipid in the diet. So we are going to take the dietary lipid. So this is the intestine. So this dietary lipid from the intestine, it comes into the circulation from the thoracic duct in a form of how this dietary lipid it is absorbed in the form of chylomicron, where the triglyceride content it is more as compared to the cholesterol. Now this triglyceride it undergo hydrolysis by lipoprotein lipase, which is an enzyme present in the vascular endothelium. So this after the hydrolysis, जब ये hydrolysis हो जाती है triglyceride की, then what will happen? Not the cholesterol, triglyceride. It is only the triglyceride which will be converted into free fatty acid, and this free fatty acid it will be utilized by the muscle. ठीक है, ये आपकी मसल है, यहाँ पे यूज हो जाएगा. मसल it is going to use as a source of energy, or either it will be get deposited into the fatty tissue, or it will be taken up by the liver. This free fatty acid, ठीक है, it will be again taken up by the liver, where it is again converted into triglyceride. Then once this chylomicron, इसमें जो triglyceride है, once it get hydrolyzed, then this chylomicron it is converted into chylomicron remnant. Now you can see here the chylomicron cholesterol level it is more as compared to the triglyceride. Then it is taken up by the liver with the help of this ApoE receptor. So ApoE, what is the main role of apoproteins? So apoprotein, they are going to help in the receptor recognition. On its surface you can see ApoE protein, they are there. So they are going to recognize this receptor and it will be taken up by the liver, and then cholesterol and triglyceride they will be stored separately. Okay, cholesterol either it will be stored as such or it get oxidized in the form of bile acid. So it is going to perform the various functions. So this is about the exogenous pathway. So exogenous pathway आपका क्या involve कर रहा है? It is going to involve mainly this what we are taking from the diet. Now coming to the endogenous pathway. Now liver itself it is going to secretes the VLDL, this very low density lipoprotein, and it is just like a chylomicron, again triglyceride content that is more, and this again undergo the hydrolysis by the same enzyme which is present in the vascular endothelium, capillary vascular endothelium, and the triglyceride that is converted into free fatty acid, and this is again the fate is same. Okay, and this VLDL it is converted into intermediate, and here again cholesterol it is more, but not sorry, here triglyceride again it is more as compared to the cholesterol, and again it will be undergoing the hydrolysis with the same enzyme and converted into the low density lipoprotein. So this low density lipoprotein, so it remain in the plasma, it will remain in the circulation. So 50% will be taken up by the liver with the help of LDL receptor, they are there on this, and remaining it will circulate in the plasma. So depending upon its need, तो ये क्या करता है in the plasma, it is going to help act as a precursor for the various steroidal hormone, and it helps in the cell membrane formation. So this is about the endogenous pathway. So liver it is going to secrete VLDL plus the nascent HDL. It is going to secrete this also. Now what is the role of this HDL? So what will happen at the various sites, the cell membrane damage that will be happen. The transport of that cholesterol from the cell wall, suppose it is an arterial cell wall, that is taken up by this HDL, this lipoprotein, it is going to take up that cholesterol from the peripheral tissue. And but how it is going to take up that cholesterol? Before that, that cholesterol, it should be esterified. Esterification will happen with the help of lecithin cholesterol acyl transferase. ये esterification के बाद what will happen? Now this HDL cholesterol, it will be transported or it will be given to whom? It will be given to LDL. ये यहाँ पे जाएगा, आपका LDL में जाएगा, या फिर ये आपका VLDL में जाएगा, या फिर आपका ये chylomicron remnant. Sorry, in the previous video I have told it is to the chylomicron. No, it's going to the, it will be transporting this cholesterol to the chylomicron remnant. It is not the chylomicron. Okay, so again this whole thing, this cholesterol, ultimately it will be transported to where? It will be transported to the cholesterol, this cholesterol, it is ultimately transported to the liver, where it is going to perform many function. So once this exogenous and endogenous pathway, if LDL level, if it is more in the plasma, agar aapka ye LDL level, if it is a more, whatever is required, so what will happen? It will undergo phagocytosis by the macrophages. But once that also comes to the saturation level, then what will happen? This LDL, it is going to cause the plaque formation in the arterial wall. ठीक है, आपकी एडिनोमा फॉर्मेशन हो जाएगी और स्किन और टेंडन में xanthoma formation will be there, and that is going to predispose to the many coronary artery diseases. So that is the time when we have to give the patient the various antidyslipidemic drug. So now you know this lipoprotein metabolism. So there are the different target which we can use by for the antidyslipidemic drug. By giving that drug, so we can decrease the level of lipids, plasma lipid level. Now coming to the drug 1. So let me make a little bit clear. So number 1, this, and clean it. So the first drug which is going to act, that is going to inhibit the intestinal sterol absorption. So that is the number 1 drug. Okay. So you know this is the cholesterol transporter. What is the full form of this one? It is Niemann-Pick C1 like Niemann-Pick C1 like 1 transporter protein. So this is going to transport the cholesterol. Which cholesterol? Which is both dietary and whatever comes with the bile acid. So it is going to help in the absorption of that cholesterol to here. Now if we give any drug which is going to inhibit this, जो इसको inhibit कर दे, ठीक है? So what is that drug? That is Ezetimibe. So this is the drug which act by inhibiting the intestinal cholesterol absorption or intestinal sterol absorption, both dietary cholesterol or the cholesterol which is coming with the bile acid. So this is a Ezetimibe. Now what happened? Whenever the absorption of this cholesterol it is less, then what will happen? Ultimately there will be compensatory increase in the synthesis of this cholesterol. So liver, it also synthesizes the cholesterol with the HMG CoA. Okay, so it is going to cause a synthesis of this is endogenous. So it is going to, there will be compensatory increase in the cholesterol synthesis. So this Ezetimibe, it is a weak hypercholesterolemic drug. So LDL cholesterol level, decreased level, it is a 15 to 20%. So it is a weak. But if we give this along with any drug which is going to inhibit this endogenous pathway, okay, like the important drug is statins. If we are going to give this drug along with this statin, then what will happen? This 15 to 20% reduction, इसकी जगह क्या होगा? 60% reduction of the cholesterol will be there. So this Ezetimibe, it is mainly used along with the statin as an add-on therapy with the statin. This is, so otherwise it is a weak hypocholesterolemic drug. So it, how this drug, when you give it by oral route, what will happen, it gets conjugated with the glucuronic acid. It is not absorbed as such. पहले क्या होगी, इसकी conjugation होगी intestine में glucuron, यहाँ पे इसकी conjugation हो जाएगी, ठीक है. It gets conjugated, then what will happen, then it will be taken to here and then ultimately secreted with the bile. So enterohepatic circulation of this drug also happens. So that is going to increase its half life. इसकी half life कितनी है, it is 22 hours. So I'll write in a next page, it is a Ezetimibe act by inhibiting PC1 like 1 transporter. It is a weak hypocholesterolemic drug, mainly used along with statin, because once it is going to decrease that absorption of the cholesterol, then compensatory mechanism क्या होगा, compensatory, there will be increase in the enzyme activity, HMG CoA reductase enzyme activity, which is going to cause the increased synthesis of the cholesterol. इसीलिए इसको किसके साथ देते हैं, we use it with the statin, and this drug it undergo enterohepatic circulation. So half life of this drug, it is 22 hours. It is a well tolerated, only we can see reversible hepatic dysfunction and myositis, that is also a rare. So this is about the Ezetimibe. Now the second group of drug, I'll see if any. So second group of the drug, that is the drug which is going to act. So number one क्या हो गया, this Ezetimibe. This is a number one drug. Now number two, the drug which act by inhibiting this HMG coenzyme reductase inhibitor, and the very important, most efficacious, the most commonly used drug clinically, that is statins. So how statins they are going to act? They act by inhibiting this HMG coenzyme reductase enzyme. So this is a rate limiting step in the synthesis of cholesterol. So what this enzyme does, it causes a conversion of this HMG co into mevalonate, and that is going to convert into the cholesterol. So ultimately there is no synthesis of the cholesterol. So what is HMG 3 hydroxy 3 methyl glutarate coenzyme? This is converted into this. So statins, what will happen now, if there is no endogenous synthesis of, if this synthesis is not there, then how, what will happen? Now the liver, it is going to take up, क्या होगा, liver is going to take up the LDL from the periphery. There will be increased expression of LDL receptor on the hepatic cell, which helps in the, so increased expression of this. So once the synthesis of this, it is going to inhibit this enzyme, then there will be increased expression of this LDL receptor, increased uptake of LDL from the periphery. So आपका plasma में क्या होगा, plasma में, in the plasma there is decrease in the level of LDL, right? So how this statin it is going to act? So statin ultimately it is going to act by inhibiting HMG CoA enzyme reductase. So by that it is going to inhibit the synthesis of cholesterol. अगर ये आपका synthesis नहीं होगा, so synthesis of cholesterol it is decreased. So second step is there is increased expression of LDL receptor on the liver cell, increased expression of LDL receptor on the liver cell. ठीक है, एक बार ये हो गया increased expression, then what will happen? So uptake of LDL by the liver cell is increased, so plasma LDL level will be decreased. So this is its main mechanism of action of this. Plus Plus this drug, it has also going to exert certain additional effect. What are those additional effect? It is so additional effect of, because that's why statin it is very commonly used because of its main effect, वो तो है ही है इसका साथ में, plus additional effect क्या है, it causes the plaque stabilization. ठीक है, ये क्या करती है, प्लॉक स्टेबलाइज करके, देन व्हाट विल हैपन, बाय स्टेबलाइजिंग द प्लॉक इट इज गोइंग टू डिक्रीज द thromboembolic events. So many times in the hip replacement surgery we put the patient on this to reduce the thromboembolic events. Then it is also going to decrease endothelial dysfunction. यहाँ पे आपका एंडोथीलियल डिसफंक्शन कैसे करता है, बाय इंक्रीजिंग द NO प्रोडक्शन, नाइट्रिक ऑक्साइड प्रोडक्शन. इट इज ऑल्सो गोइंग टू डिक्रीज द ऑक्सीडेशन ऑफ LDL by decreasing the plaque stabilization. कैसे होगी, by decreasing the inflammation, suppression of the inflammation. So it is also, these are its additional effect of this statins. Now how many type of statins we have? So statins हमारे पास कौन कौन से हैं? We have a rovastatin, we have a simvastatins, we have a pravastatins, atorvastatins, rosuvastatins and pitavastatins. ठीक है, so difference is only in its potency and efficacy and little bit of pharmacokinetic characteristics. जैसे सबसे पहले क्या आती है, the first one lovastatin. ठीक है, it is not that potent or efficacious as compared to, if we compare it with this atorvastatin and rosuvastatin. ठीक है, half life इसकी क्या है, 2 to 4 hours. simvastatin the another one, इसकी half life क्या है, 2 to 3 hours. Pravastatin, though it is a potent as compared to simvastatin and lovastatin, half life इसकी भी कम है. Whereas later on this is the longest acting rosuvastatin. ठीक है, इसकी कितनी है, 18 to 24 hours longest acting. इसकी कितनी है, 14 hours तक. And how much this one is, again 12 to 14 hours. This one is also same, 14 to 18 hours. So this is most commonly used, atorvastatin and rosuvastatin. ठीक है, they are potent and they are very commonly used. Now what are the important things you must know about this statin? Number one is we give it by oral route, and at what time of the day we prefer to give it. It is usually given in the night because HMG coenzyme reductase, this enzyme activity that is maximum seen in the midnight. ठीक है, तो इसको कब देते हैं, इसको हमने रात को देने, बिकॉज रात को वो जो एंजाइम है, दिस एंजाइम, इसकी जो एक्टिविटी है दैट इज मैक्सिमम इन द नाइट, दिस एंजाइम. सो हमने ये ड्रग कैसे करती है, दिस इज गोइंग टू एक्ट बाय इनहिबिटिंग दिस एंजाइम. इस एंजाइम की एक्टिविटी अगर रात को है तो वी हैव टू गिव, मिड नाइट में है तो वी हैव टू गिव दिस ड्रग in the night. But if we are giving this atorvastatin and rosuvastatin whose half life is enough, so we can give it at any time of the day. This is number one. So when to give. Number two is it get metabolized by cytochrome 3A4. So important drug interaction with the enzyme, especially with the enzyme inhibitor. किसके साथ, like erythromycin, macrolide वाले ग्रुप हो गया, erythromycin हो गया, आपका clarithromycin हो गया, clarithromycin, then ketoconazole, then another is protease inhibitor जो आप HIV के लिए यूज़ करते हो, protease inhibitor that is there. Then in this group only the fibrates, with that certain side effects they are added if you are going to give it with the fibrates. So these are the important interaction. So हमने कब देनी, in the night. And now what are the important side effect with this drug? Side effect इसके कैसे याद करेंगे, easy to remember, HMGA, the most common, coenzyme reductase, पकड़ लो ये R and H, hepatotoxicity and rhabdomyolysis. So muscle aches इसके इज वेरी वेल टॉलरेटेड ड्रग, ठीक है, तभी बड़ी कॉमनली यूज होती है. फ्यू GIT साइड इफेक्ट्स दे आर देयर, ठीक है, पर इसमें मेनली क्या है, द मसल एक्स दैट इज वेरी कॉमन. सीरम हिपेटोटॉक्सिक सीरम ट्रांसएमिनेज लेवल, इसको हिपेटोटॉक्सिक H इसलिए समथिंग रिलेटेड विद द लिवर, जस्ट टू मेमोराइज, ठीक है, समथिंग रिलेटेड विद द लिवर. सो इट इज गोइंग टू इंक्रीज द लेवल ऑफ सीरम ट्रांसएमिनेज. सो जब भी ये वाली ड्रग देनी है आपको लिवर फंक्शन टेस्ट आपको करवाते रहना है, ठीक है. अदरवाइज मसल एक्स है, फ्यू केसेस ऑफ मायोलजिया एंड रेब्डोमायोपैथी, दैट इज ऑल्सो अ सीरियस वन. देन रेब्डोमायोलाइसिस, ठीक है, एंड अदर ड्रग दिस फाइब्रेट, this also especially the gem fibrosol that also cause the myopathy and gem fibrosol also cause the rhabdomyolysis. So ये वाली drug इसके साथ we should not give, ठीक है, because add on effect will be there. So in the fibrate gem fibrosol that is there, then we have benz fibrate, then we have a phenofibrate. अगर कभी आपको statin को fibrate के साथ if you have to combine these two drug then you can combine it with the phenofibrate. So this is about the side effect. Now where to give this statin, कब आपने देनी है. So this statin basically it is going to decrease the level of what, LDL, ठीक है. सॉरी, फर्स्ट अगेन व्हाट आर द अदर साइड इफेक्ट विद दिस. एक तो ये आपका हिपेटोटॉक्सिसिटी हो गया, रेब्डोमायोलाइसिस हो गया, एंड देन इट ऑल्सो इंक्रीज द लेवल ऑफ ब्लड शुगर. दिस इज वेरी इंपॉर्टेंट. So it can, so though it increases the blood sugar level, but statins they are very commonly prescribed drug in the diabetic patient. ये है. This here you must know कि though it increases the level of blood sugar, but still be prescribed the statin. Why? Because of its additional effect. Plaque stabilization, decreases the thromboembolic event. So by that it is going to decrease the coronary artery disease, that events it is decreased, because diabetic patient they are very prone for this. So once you are putting this drug to the diabetic patient, then what will happen, so आपने जो उस patient की anti diabetic medication है ना, you adjust the dose of that, because this drug it is also going to increase the level. So accordingly to increase you have to increase or you have to add some other drug, anti diabetic drug to that particular patient. But even in it though, so कहने का मतलब क्या है, though it increases the level of blood sugar, but still we what we do, we give this one even to the diabetic patient. Now where to give this statin, so we can give in both type of hyperlipoproteinemia, चाहे वो सेकेंडरी है चाहे प्राइमरी है. सेकेंडरी जैसे नेफ्रोटिक सिंड्रोम हो गया, डायबिटिक पेशेंट हो गया, इसमें आप दे सकते हो. प्राइमरी कहाँ पे, प्राइमरी, सो लास्ट टाइम मैं टोल्ड देयर आर द 5 टाइप ऑफ हाइपरलिपोप्रोटीनेमिया. कितनी तरह के, 5. 1, 2A, 2B, 3, 4 and 5. If you remember, first one is a familiar lipoprotein lipase deficiency. तो इसमें आपका क्या है, काइलोमाइक्रोन लेवल वो बढ़ जाएगा. Then these two they are related with the increased level of cholesterol. So second A that is a familial hypercholesterolemia. Second B is a polygenic hypercholesterolemia. So this drug it is, so जहाँ पे hypercholesterolemia that means it is we are talking about increased level of LDL cholesterol. So this drug we can give to the, इसमें दे सकते हैं 2A, 2B. Then this last one, this is a combined hyperlipidemia, and this is a hypertriglyceridemia, ठीक है. एंड थर्ड में क्या है आपका, डिसबीटा लिपोप्रोटीनीमिया, फैमिलियल डिसबीटा लिपोप्रोटीनीमिया. सो इसको हम कहाँ पे देंगे, वी आर गोइंग टू पुट द पेशेंट ऑन दिस एंड दिस, ठीक है, इसमें हम देंगे. सो 4 वाले कहाँ पे, बिकॉज इट मेनली इट इज गोइंग टू डिक्रीज द लेवल ऑफ LDL cholesterol. So this is all about the statin. So I have covered the 2 drug. Coming to the drug number 3. So third one is, it is a bile acid binding resins. So what happens in the bile, so liver it is going to secrete the, it is going to cause the formation of the bile, and that bile it is stored in the gallbladder, ठीक है. जब भी then what will happen, it will be from the bile duct, यहाँ पे समझ लो there is a gallbladder, and from the bile duct this bile it is coming. ठीक है. Now this biles it help in the absorption of, you are taking the dietary cholesterol that is there. I'll draw in another form. ठीक है. Suppose this is the dietary cholesterol. ठीक है. And now bile it binds with, it is going to help in the absorption of this cholesterol. ठीक है. आपने डाइट में कोलेस्ट्रॉल लिया. नाउ दिस बाइल फ्रॉम द बाइल डक्ट, दिस रेड कलर, दिस इज अ दिस जो बीच में डॉट बनाया, दिस रेड कलर, दिस इज अ कोलेस्ट्रॉल एंड दिस पिंक कलर you think it is a bile. Then what will happen? Bile it helps in the absorption of the, ये bile किधर से है? From the gallbladder, bile duct इधर intestine में आ गया. Then what will happen? It is going to help in the absorption of this cholesterol and again it will go to the liver. ठीक है. और liver में क्या हो गया? Cholesterol यहाँ पे रह गया and bile it will be again move to the gallbladder और gallbladder से फिर. So what will happen? This bile it helps in the absorption of many molecule of the cholesterol. Again I repeat, we take this cholesterol in the diet, red color का है, and this cholesterol it is absorbed with the help of bile. यहाँ से जाके bile में, and in the liver what will happen? Again this bile it will again move to the gallbladder, again it gets secreted और cholesterol यहाँ पे है. So this bile it helps in the absorption of the dietary cholesterol. ये बार बार a single molecule of bile it is going to rotate. Now if I give something which binds with this, जो इस पूरे के साथ, so that is a bile acid binding resins या agent, आपको ऐसे भी कर लो, bile acid binding agent or bile acid binding resins. If I going to give that drug, it is going to bind here. एक बार इसके साथ bind होगी, then ये जो आपका है, this circulation is there, this won't happen. This enterohepatic circulation of the bile, it won't happen. Then what will happen? It is going to get excreted. ये आपका क्या होगा? It will be excreted in the feces. ये पूरा का पूरा complex. अब क्या है? Now bile is also excreted. एक single bile molecule which helps in the absorption of so many cholesterol molecule. Now what will happen? Liver has to make more bile from the cholesterol. अब कोलेस्ट्रॉल से क्या है आपका? कोलेस्ट्रॉल जो आपका यहाँ पे है लिवर में, आपके ट्राइग्लिसराइड एंड कोलेस्ट्रॉल, दे कॉजेज द सिक्रीशन ऑफ दिस, दे कॉजेज द सिक्रीशन ऑफ दिस बाइल. नाउ व्हाट विल हैपन? दैट देयर इज अ शिफ्टिंग ऑफ दिस. ये किधर आएगा? दिस इज गोइंग टू हेल्प इन मेकिंग मोर कोलेस्ट्रॉल. अब मोर बाइल, सो कोलेस्ट्रॉल किधर लग गया? आपका बाइल बनाने में. अब नाउ हाउ द लिवर इज गोइंग टू गेट दिस कोलेस्ट्रॉल? फ्रॉम द पेरीफ्री, LDL receptor. So serum or a plasma LDL level will decrease. So this is how bile acid binding resins they are going to work. So what drug we have here? We have a cholestyramine, then we have a cholestipol and cholecalciferol. These are the three drugs which act by this way, and out of this one is present in a sachet form. आपको ये powder form में मिलता है, so it is not palatable, so patient compliance that is very poor. अगर किसी को powder में उसमें कोई it's unpalatable, so compliance it is very bad with this cholestipol. E is not there, whereas this one cholecalciferol, this is present in the form of tablet. ये ले सकते हैं हम. So this is going to decrease the level of the bile, and ultimately what will happen? The shifting of that cholesterol, it is going to more, now cholesterol is required for the synthesis of more bile. So with this what will happen? Sometimes few vitamins they are also not absorbed, so vitamin deficiency वो भी हो जाती है इससे, bile acid binding resin से. So important here is this is not absorbed. ये देखो कहीं पे भी circulation में नहीं गया, bile acid binding resins it is not. So we can use this one safely in a pregnancy. Bile acid binding resins इसको हम, जैसे statin it should not be given during the pregnancy, इसको हम कर सकते हैं. We can use this one in a during the pregnancy. So this is a number 3 drug. Now number 4 drug. Number 4 drug is fibrates. ठीक है. Now how the fibrates they are going to act? So fibrate they are I'll write here. So fibrates और फाइब्रिक एसिड डेरिवेटिव जिसमें कि आपकी ड्रग्स आती हैं, वी हैव जेम फाइब्रोजिल, वी हैव benzofibrate, and we have a phenofibrate. These are the three drugs. So now what are they? They are the PPAR alpha agonist. Now what is the full form of PPAR alpha agonist? It is a nuclear peroxisome proliferated activated receptor alpha agonist. ये क्या है आपके? Nuclear peroxisome, I'll write here, nuclear peroxisome proliferator receptor alpha agonist. और ये किस तरह के रिसेप्टर है? They are the receptor which is going to regulate the gene expression. They are the receptor which are going to regulate the gene expression. So by doing this, what will happen? It is going to cause the increased expression of the few genes. Okay, increased expression of the few genes, increased expression of the few genes which is going to and decreased expression of the certain genes, regulating the different kind of the proteins or different kind of enzyme. This is how it is going to act. Now I will say now which it is going to increase. It causes the increased expression of the gene which is going to regulate कौन सी gene? Lipoprotein lipase. It causes the overexpression of, I'll write clearly here, it is going to cause the increased expression of LPL gene. ठीक है. Now if this expression, if it is increased, ये वाला, ठीक है, अगर आपका यहाँ पे LPL, if this expression, if this is increased, then what will happen? If this is increased, then lipolysis of this triglyceride, यहाँ पे और यहाँ पे lipolysis will be more. So it is mainly decreasing the level of triglyceride. ठीक है. So fibrate क्या करते हैं? They are going to decrease the level of triglyceride. So what will happen if it is going to increase that this triglyceride lipolysis, and VLD will be converted into IDL and LDL. So ultimately they are going to decrease the level of triglyceride, but they increase the level of LDL cholesterol. So mainly this one, this is not seen with these two, especially with this. ये तो बहुत ही कम करता है. This is not increasing the level of LDL cholesterol. So this is the number one. It is going to cause the expression of increased expression of LPL gene. So what will happen? There will be lipolysis. ठीक है. So it is going to decrease the level of triglyceride. Number one is this. Second one is it is also going to increase the expression of gene which regulate LDL receptor. ठीक है. अगर LDL receptor expression हुआ तो then what will happen? ये जो आपका बड़ा LDL, ठीक है, then it will be taken up by the liver. So increased uptake of the LDL from the periphery by the liver, which is seen mainly by these two drugs. Then number three, it also increase the expression of the gene which regulate ApoA synthesis. Now ApoA, this is the apoprotein which is coordinated with the high density lipoprotein. ठीक है. इसके साथ this is a protective one. It is going to remove the cholesterol from the peripheral tissue. Then it is going to decrease the expression of gene which regulate ApoC. ठीक है. Now ApoC, it is going to decrease the, this is the normal. ApoC क्या करता है? It is going to decrease the lipolysis. ये lipolysis को कम करता है. But if any drug, if it is decreasing the level of this, तो उससे क्या होगा? There will be increased lipolysis. Same effect हो गया. ये वाला और ये वाला, ultimately the net effect is same, this and this. ठीक है, this is how the fibrate they act. So fibrate, they are basically PPAR agonist, so they are going to cause the they are going to increase the expression of the certain genes and decrease the expression of the certain genes. So few enzyme or proteins, they are the up regulated and certain they are the down regulated, or there will be decrease in the level of this. Now coming to this, where this this drug it is going to help. First I'll see it's a side effect. Gem fibrosol, benzafibrate and fenofibrate. इसमें भी क्या है, rhabdomyolysis, that is very common with the gem myopathy, rhabdomyolysis, that is very common with the gem fibrosol. तभी बोला था statin should not be given with the gem fibrosol, whereas fenofibrate it is the least potency, so we can give this one. अगर कभी भी पड़ता है कि statin के साथ कौन सी fibrate देनी है, we can give the fenofibrate. जेम फाइब्रोजल एंड बेंज फाइब्रेट, ये दोनों कोई भी नहीं देंगे, वी कैन सेफली यूज फिनोफाइब्रेट इफ इन केस वी हैव टू ज्वाइन. सेकेंड वन इज it is going to cause the increased risk of the gallstone, cholelithiasis and gallstone. That is another side effect with this drug. Okay, so that is about the side effect of this. Now this is also used in hypertriglyceridemia. This is used in hypertriglyceridemia. So I told you this one in the previous slide. I'll just focus this one. ठीक है, तो इसमें हम कौन कौन से प्राइमरी हाइपरलिपोप्रोटीनीमिया में वी कैन यूज दिस ड्रग. सो वी कैन यूज दिस वन इन हियर मेनली 4. इसमें आपका कंबाइंड है, इसमें भी 4, 5 एंड दिस इज द डिस बीटा लिपोप्रोटीनीमिया. तो दिस ड्रग इट इज़ मेनली यूज्ड हियर बिकॉज इट डिक्रीजेज द लेवल ऑफ triglyceride. So any patient with the raised level of triglyceride, and if that along with the LDL that is also increased, we can put the patient on this, not this one. This is not going to take care of the LDL level, whereas this one it is going to take the level of this. And rhabdomyolysis and cholelithiasis, that is very very less. It is not seen with the fenofibrate. So this is about the fibrate. Now next group of drug is we have the drug which inhibit the lipolysis. उसमें हमारी कौन सी आती है, nicotinic acid or niacin. This is a vitamin B. So in high doses we have to give, high doses only it is going to act as a antidyslipidemic drug. Now what it does on this adipose tissue, this is the adipose tissue, on its surface we have a G protein coupled receptor. If you can remember 109A, this is a receptor. So this receptor it is going to inhibit this adenyl cyclase activity. Okay, so this receptor it is linked with the adenyl cyclase, and once niacin it binds with this receptor, it is going to inhibit this adenyl cyclase. Then by inhibiting this, it is going to inhibit the lipolysis. Okay, so niacin it binds with the receptor which is present on the adipose tissue, that is GP109A, and by acting on this it is going to inhibit the action of this inhibitory action adenyl cyclase. It is going to inhibit the lipolysis. Suppose lipolysis अगर fat में नहीं होती, with the lipolysis what is there is ultimately what it is going to form, it is going to form the free fatty acid, and this free fatty acid it is the precursor of what, triglyceride, which is taken up by the liver, and ultimately there is a synthesis of VLDL. So what happens, niacin it inhibit the lipolysis in adipose tissue. This is a mechanism, it inhibits the lipolysis in adipose tissue and inhibits the VLDL secretion from the from the liver. ठीक है, it is going to decrease. अगर ये नहीं आएगा, VLDL नहीं आएगा, this will be also not there, this also won't be there. So ultimately this drug, niacin or nicotinic acid, this is also going to decrease the level of triglyceride plus LDL cholesterol. So this is how niacin or nicotinic acid that is going to act, because already I have told this drug it has to be given a high dose, like आप 1 gram देते हैं, and few patients they cannot take up this dose, and it's important, the most important adverse effect, it is a vasodilator, cutaneous vasodilator. And that is due to because of this prostaglandins D2, and we have to give, इसको हमने कैसे prevent करना है, beforehand you can give the sustained release tablet of aspirin, and the latest one is laropiprant. This is direct prostaglandin D2 inhibitor. So we can give with the nicotinic acid or niacin, this or this, to prevent this cutaneous vasodilator. What are the other side effects with this? Dryness that is seen, hyperpigmentation of the skin, sorry, hyperpigmentation of the skin that is seen. This is also going to cause the increase the level of blood glucose. So hyperglycemia will happen. So it can precipitate the diabetes. So should not be given in the patient with the diabetes. Then hyperuricemia, it is going to cause that also. So it is not to be given during pregnancy. So where we are going to use this one, it is again because it mainly, this is the drug which decreases this triglyceride level, plus it also increases the HDL cholesterol level. Okay, so where we are going to give this drug again, hypertriglyceridemia आपकी क्या होगी, नंबर 3, 4 and 5, जिसमें आपका combined है, जिसमें आपका only the triglyceride level that is increased, there we can give this group of drug. So in the end, I am just revising what all type of drug. So this is the drug which I have discussed in today's lecture. This is a well established and antidyslipidemic drug. There are few newly developed antidyslipidemic drugs. So this lecture was all about the well established antidyslipidemic drug. So first is Ezetimibe. ये कैसे करती है? It is going to act by inhibiting this transporter, Niemann-Pack C1 like 1 transporter, which helps in the absorption of the cholesterol, both dietary as well as the cholesterol which is absorbed with the bile. Then second one is this I have told statins. Statins, it inhibits the synthesis of this cholesterol by inhibiting the rate limiting step, that is a cholesterol HMG coenzyme reductase inhibitor. So these are the various we have. So when we are giving, see, always remember why we are giving this Ezetimibe and statin. Usually we give in a combination. जब हमने Ezetimibe दिया, ठीक है, it inhibits the absorption of the dietary cholesterol. So compensatory, there is a increased activity of this enzyme. इसकी activity आपकी बढ़ जाएगी. So activity of this is increased. This, ठीक है. So again there will be increased synthesis of cholesterol. यहाँ से अगर आपका intestine से absorb नहीं हो गया तो liver से हो गया. लिवर से सिंथेसिस ज़्यादा हो गई कोलेस्ट्रॉल की, ठीक है. सो बट इफ सपोज हेयर इफ आई एम गिविंग द स्टैटिन, देन व्हाट विल हैपन, फ्रॉम द इंटेस्टाइन, फ्रॉम द लिवर, द सिंथेसिस ऑफ दिस कोलेस्ट्रॉल इट इज डिक्रीज्ड. अगर ये डिक्रीज हुआ, देन कॉम्पनसेटरी इंक्रीज ऑफ द कोलेस्ट्रॉल फ्रॉम द इंटेस्टाइन विल हैपन, ठीक है. तो अगर मैंने इसको इनिबिट किया तो लिवर ज़्यादा बनाएगा, स्टैटिन दे के लिवर वाला इनिबिट किया तो इंटेस्टाइन से एब्जॉर्प्शन ज़्यादा होगी. दैट्स वाई वी यूजुअली गिव स्टैटिन अलॉन्ग विद द एजेटिमाइब. सो ये सिनर्जिस्टिक कॉम्बिनेशन बनता है. तो दिस इज अ नंबर 2 ड्रग. नंबर 3 इज bile acid binding resins, that is a cholestyramine, cholestyramine and a cholecebulum, ठीक है. And then number 4, how they are going to act, bile acid binding resins, they are going to bind with the bile acid के साथ जो cholesterol है, it is going to bind with that and ultimately get excreted, and that bile acid, that enterohepatic circulation of that bile acid, it is going to inhibit that. So ultimately what will happen, bile acid आपका it is excreted in the feces. Now cholesterol, it has to make more bile, and for the synthesis of the bile it needs a cholesterol, so it is going to take up from the peripheral blood, so more LDL will be taken up from the plasma, so ultimately there is a decrease in the level of cholesterol in the plasma. Then number 4 is this group of drug, fibrates. ये क्या है, ये आपके PPAR alpha agonist or activator. So what they do, they are going to increase the activity of gene expression. Gene expression किसकी करेंगे? So most of the enzyme like LPL enzyme mainly. So lipolysis, with the lipolysis what will happen, it is going to decrease the level of triglyceride. Then ultimately it is going to increase the level of LDL cholesterol. Okay, then it is also going to increase the expression of this LDL. So this LDL will be taken up by this, then it is going to increase the expression of the gene which regulate the synthesis of ApoA. So that ApoA ultimately it is going to cause the activity of this HDL cholesterol, which is going to remove the cholesterol from the peripheral tissue. Then it is going to decrease the activity of ApoC2, and that is going to inhibit the lipolysis. Okay, so by inhibiting the ApoC1 it is going to promote the lipolysis. This is how fibrates they are going to act. Then the 5th one is niacin. Niacin, they are going to inhibit the lipolysis at the adipose tissue, and thus they are going to decrease the availability of free fatty acid and triglyceride, which is going to, the influx will be in the liver, and ultimately that triglyceride, the availability of that triglyceride for the VLDL, that is decreased. If this is decreased, then ultimately intermediate density lipoprotein and low density lipoprotein, all they will be decreased. So that's all about the this thing. Antidyslipidemic drug. This is the one table which I have taken from the this Kadzan. So here you can see all the drug. It is a simple way, like if the end moment revision you can do it from this table. Like the first drug I have told this one, आपको ये वाली बताई मैंने, Ezetimibe. यहाँ पे mechanism of action है, what effect it does, so where, what are its clinical implication, and the last table is about the ADR. Then I have told about the statins. ये थोड़ा सा है ऐसे, so you can see now statins about its toxicity or drug interaction. Then I have told about this number 3, bile acid sequestrants or bile acid binding agent, then fibrates, and the last one is a niacin. So that's all about the antidyslipidemic drug. So if you like my video, please give a thumbs up, or if you have any comments or any suggestion, you can put that up in the comment section. Thank you.